Thank you.
Okay. So, Victor, one more question, which is after recovery. So we said after recovery, the patient will be immune from coronavirus, but how long it will last?
Sir,
is there a specific period, time?
Yes. In my presentation, there is a graph showing IgM and IgG. Whenever there is an IgM increase, it indicates acute infection, and IgG then starts after IgM. It starts elevating in the right level. When, as long as the IgG is in the circulation, it depends upon each patient. That's why patients who are convalescent in the convalescent period, we take the plasma and purify it and get the FDA approval and inject in another patient who is acutely ill to come out of the infection. It has been proved and it has been approved by FDA. But the patient who are in the convalescent stage will have their antibody coming down. We won't know at what time it goes below the threshold level to get the virus to get reinfected. So ideally, IgG will stay in the circulation for at least 2 to 3 months. That's why every pandemic, we wait for at least 3 to 4 months to settle, because this type of natural infection will be there for 3 to 4 months and all the people will get immune and the infection will go off.
Okay. So so you answer, I think, this question, because there is one question said if the infection will be reoccur, what is the benefit of the vaccine? So we are talking about now the timing. So maybe it will not occur within years. Maybe sometimes it will take time.
Yes, absolutely. Now,
is that correct?
Yes. This immunity, there are 2 types of immunity, active immunity and passive immunity. So now we are considering only about passive immunity. Active immunity means since the virus changes its drift and shift, we will not be able to devise a vaccine which gives 100% protection. That's a major drawback for influenza viruses as well as this coronavirus.
Okay. Thank you very much. So I would ask Dr. Danish. Is unmute his mic.
Yes, sir.
Dr. Danish, this is after quarantine. The number of cases now in Saudi Arabia, it's increased. Is there an explanation for that?
Sir, so far as I am concerned, I think we are not following social distancing and quarantine, self-isolation, hand washing, and use of face masks properly, because then only there will be a flattening of curve. Flattening of curve, if you understand it, as in an epidemic curve, there are large number of cases in a very short time. That is during a spike. And we don't want the new cases to occur or the spread of infection. So there will be few cases in flattening of curve, and we prevent the occurring of large number of cases in a very short time. And this will also cause a decrease in the health burden all over. So I think it is because we are not following social distancing, quarantine, self-isolation, use of hand washing, use of face masks, and all these things, because of which the cases in Saudi Arabia are still going on increasing.
Okay, thank you very much. But Dr. Danish, there is one more question. It said, how do you assess the case fatality rate here in Saudi Arabia? Does the latest number of deaths that we are fighting COVID-19 the best way possible?
Yes.
So the fatality rate, we are asking about
fatality rate.
So do you think that the death rate here in Saudi Arabia, in compare with other countries, we are like controlling the disease, the infection, or the fatality rate is high? Since I think we didn't.
No, sir. The death rate is still very less as compared to the number of cases which are very high in Saudi Arabia.
There is one question to Dr. Ashraf. Are people with DM, diabetes mellitus, more likely to get the COVID-19? or they have higher chance?
As far as the comorbidities are concerned, because this is the main data which is available in the present scenario, that the people who are more than 65 years of age and those who are having the comorbidities, and along with the diabetes mellitus has been specifically mentioned that those patients who are suffering from diabetes mellitus, they are more prone to COVID-19 and they develop actually the severe or the critical condition of the COVID-19 patient. And so particularly that is the reason that those patients with COVID-19, with these comorbidities, they should go for the test even if they are not having the symptoms. Because one thing is which is very important in the presentation of these patients with comorbidity and those with the senior citizens more than 65 years of age, they are advised that if they are having mild symptoms or atypical symptoms, not the typical respiratory symptoms, they should go and get themselves tested. So this is the data which is available. So they are more prone. The diabetes mellitus, patients suffering from diabetes mellitus are more prone to develop severe form of COVID-19 disease.
Okay. Dr. Prasanna, there is one question asking about the virus, the natural of the virus. Is it a human produced or is it natural, or do you have anything regarding this?
Yes. Whenever this virus's transmission is concerned, am I audible, sir? Am I audible?
Yeah, I can hear you.
When this virus transmission was studied by the WHO people, they noted that most of the studies till now suggest that the coronavirus has got a common origin from the bats. But from the bats, during their evolution towards humans, they have a lot of intermediate hosts. For example, in MERS-CoV, it is camel. It's an intermediate host. For example, in case of COVID-19, it was a civet. Civet is like an alligator, which gets the transmission from the bats and pass it on to the human beings. But till now, there is no study or article published that the coronavirus comes from this particular animal, because most of the coronaviruses are in the bats. But till now, we don't have any clue. We don't have any clue to say that this particular animal transmits this type of coronavirus, because most of the coronaviruses are in the bats.